1 Pa G. Fresenius RN exam, actual exam preparation newest. 2025/2026 complete 400 questions and correct. Detailed answers, verified answers, brand new. Version. Diffusion is the movement of underscore from an area of higher concentration of solutes to an area of lower concentration of solutes. A solvent, a solution, solutes. Fluid, answer, solutes. Which of the following would keep KCN values stable during treatment? Poor arterial flow from access. Missed heparin dose. Blood flow rate, BFR, set at prescribed rate. Clotting in the dialyzer. Answer, blood flow rate, BFR, set at prescribed rate. Which of the following would be a CMS trigger during a survey? 1/4. 2 Pa G. Supplies taken to patient station are disposed, disinfected, and dedicated to that patient. Blood spills that are immediately cleaned. Using aseptic technique when administering medications. Multi-dose medication vial punctured with previously used needle/syringe. Answer, multi-dose medication vial punctured with previously used needle/syringe. What should you do with sharp containers in the event of a flood? Leave them on the machines. Lock, seal, and place them in a biohazard storage room. Send them home with the patients. Put them in waterproof containers with medical records. Answer, lock, seal, and place them in a biohazard storage room. Which of the following is an example of good infection control? Techniques when administering medications. Only wearing gloves to administer IVP medications. Using common tray/cart to administer medications from station to station. Preparing medications as close to time of use as possible, no more than 4 hours prior to administration. 2/4. Buggy. Storing vials in clothing or pockets. Answer, preparing medications as close to time of use as possible, no more than 4 hours prior to administration. For iron is given to increase iron stores in patients. Which of the following is correct regarding IV therapy? It is okay to administer 4 iron rapidly via IVP. Oral iron would be just as effective as 4 iron to achieve adequate iron stores. Possible side effects of 4 iron may include hypotension, rash, pruritus, and wheezing. Transferrin is the only lab value that is to be monitored when dosing 4 iron. Answer, possible side effects of 4 iron may include hypotension, rash, pruritus, and wheezing. Which of the following is true about anticoagulants? Anticoagulants can dissolve clots in the ECC. The use if anticoagulants does not impact adequacy of treatment. Heparin should be used for patients that have HIT. The patient should be assessed for recent falls before administration. Answer, the patient should be assessed for recent falls before administration. What must you do when using the emergency hand crank during a power outage? 3/4. Buggy. Remove the arterial chamber. Rotate the dialyzer. Monitor for air in the line after the venous chamber. Remove the blood pump segment. Answer, monitor for air in the line after the venous chamber. What term is defined as a failure to follow established procedures? Treatment prescriptions, or an event that causes patient injury or death. Incident or occurrence. Good catch. Near miss. Adverse event. Answer, adverse event. Which of the following is true about ultra-low total chlorine testing? The RO must run for 10 minutes. The sample cup must be rinsed 3 times. The sample might be 200 ml. The sample port must run for 5 minutes. Answer, the sample cup must be rinsed 3 times. What is the limit for total chlorine? Less than 1.0 ppm. Less than 0.5 ppm, powered by TCPDF, www.tcpdf.org. For /4.